All right, hi everybody. I am Tom Maxson, LMBT, here at Hands on Health in Cary, North Carolina. It is this week World Reflexology Week, and I'm doing a couple of demonstrations today of reflexology techniques, kind of so you can see what you would expect when you come in for a treatment. And I'm going to talk a bit about what I'm doing and why, and what is reflexology. And right now I'm going to do a hand demonstration, hand reflexology. I know feet are known a little more broadly as the reflexology of choice, but hands are extremely effective, and there's good science backing that up, that there is benefits to receiving hand reflexology. And I'm going to talk through some of those and hopefully be clear and coherent. I haven't talked while I've worked for quite a while now. I haven't been teaching here at bodywork therapy seminars very much, and especially with the mask on. So bear with me, and hopefully you enjoy what I do and what I say. I'm going to get this set up and get going on the hands. Right. So what is reflexology? The basic definition, the thing that sets reflexology apart from massage therapy, is that the extremities, meaning the feet or the hands or the face or the ears, have an organized, mappable arrangement of every other part of the body on them. We follow detailed reflexology maps that represent every tissue of the body, every organ, every system in some way is represented on the hands and on the feet. And by doing kind of the trademark press and release technique, or an inchworm technique, we call it sometimes, where we just kind of press and release as we go through the surface of the extremity we're working, we're going to create relaxation. This is a neurologically based technique. Yes, I'm touching muscles, and yes, I'm touching connective tissue, but what I'm thinking is communicating to the client's brain to re-examine the area that I'm working on, that zone of the body that's connected to the zone on the hand that I'm touching. For example, the thumb is the head and neck. So I'm thinking, as I work through it, what can I feel in the thumb joints that represents what's going on in the neck above in the client? Is there grinding? Is there clicking? Is there overuse? Is there heat? Is there immobility or hypomobility? Where in the joint is that? All of those cues can give me an idea where the stress is in the body. And as I work through the entire surface of the top and the bottom of the hands, I'm going to be hopefully creating balance throughout the entire body of the person. This is not about diagnosing or treating specific conditions like a medical practitioner would. This is about alleviating stress, about helping the body achieve a restful, restorative balance in the nervous system. The technical term, parasympathetic nervous system, rest and digest, as opposed to fight or flight mode. Trying to get our bodies away from high stress, stress hormones, overuse, especially in our hands. We run really hot. We are constantly using our hands to use tools, to use our phones, to use computers, to drive. We are so plugged in to all of our technology, and pretty much everything we do in our day involves our hands. And there's a direct connection between our hands neurologically and our brain. We learn things, we pick things up and examine them and feel them primarily with our hands. And there's a lot of information and a lot of bandwidth, you could say, in your brain based on what's going on in your hands. And if I can help relieve some of that stress and help the brain focus on what's going on in the hands, the performance of the hand is going to improve. That's the general theory of reflexology. Hand reflexology has been studied with some promising results in terms of improving sleep, lowering anxiety, improving fatigue, improving depression. Really big health issues that we're facing right now. Anxiety is the number one diagnosis in psychiatric medicine, psychology. We have a lot of really anxious people in this country, and reflexology can help support a more healthy mental environment. One of the interesting things about World Reflexology Week, which is this week, the last week of September every year, is that we get to bring some light to what's going on in reflexology, in the science, in the standards of practice. All over the world, people are doing this technique, and depending on what country you're in, what area of the world, what jurisdiction, reflexology might fall under massage therapy. It might fall under some other form of body work. It might be an independent practice from all other labels. And in many places in the world, it's seen more as a nursing technique. There are nurses who are trained to do reflexology on all types of patients in hospitals. A lot of the good research that's been coming out in the last several years has been at university hospitals, several in the Middle East, Iran. Taiwan has put out some good studies in the last several years. Just in the United States, as a practitioner in North Carolina, in the United States, it's seen as mostly a spa therapy, as just a feel-good technique to make the body feel nice, which it does. But I believe there's a lot more to the technique of reflexology than just putting yourself to sleep. At our practice here, Hands on Health in Cary, North Carolina, we are all licensed massage and bodywork therapists, and the massage board has recently extended the umbrella of massage therapy over reflexology. And there's some debate with reflexologists if we should, as a reflexologist, regulate ourselves with our own system of training and standards and examination, or if we should fall under massage therapy because we are doing body work. Yeah, so there's a lot of legislative activity going on right now trying to get attention for reflexology as a separate technique from massage therapy, which has been a really interesting dynamic for me. I came from Florida originally, and I learned reflexology in Florida from a massage therapist. And you have to be licensed as a massage therapist in Florida to practice reflexology professionally. So I moved to North Carolina a couple of years ago, and that was very different. The environment here is different than it was there. So it's an interesting study to see how every state handles it individually. We really don't have much standardization in terms of massage or reflexology regulation in this country, and I would like to see a lot more organization in that way. So I'm going through the hands, the palmar side of the hand now, just bit by bit by bit. Every press and release, I'm going to send a signal to the brain. I'm thinking about flipping a light switch on and off, like electricity between the hand and the brain. I'm not really thinking about what's going on in the muscles of the hand. The pressure that I'm using should be enough that the client can feel it, but it's not about the pressure. Less is more with reflexology. I don't need to prove anything. I don't need to be super strong to make my point to their brain. Our hands are neurologically very sensitive. I could take a toothpick and very gently poke her hand and she would be able to feel it. I don't need to get my elbows and forearms involved in doing reflexology. Even on the tough parts of the foot, the feet are also super sensitive to this kind of stimulation. The hands are so elegant in how they can move with the fine motor skills, and they can be incredibly strong in terms of grip strength and resilience to repetitive stress. There's all kinds of information that goes to the brain and back so fast we couldn't possibly consciously think through all of that information as we do it. All of the movements of our hands, how tight do we need to hold it, how much pressure do we need to exert, how much nuance we can get out of our hands without even consciously thinking about it. It's pretty incredible. And generally speaking, Reflexology, we work from the wrist through the hand or from the ankle down through the foot. We might do a little bit of work further up into the forearm, but that's where I would start thinking a lot more in terms of myofascial release, neuromuscular therapy, trigger points. There's a lot of connective tissue in the forearm joint into the elbow, supporting that, stabilizing that, a lot of tendons. So reflexology is on the extremity, and I would change over to massage when I'm going to start working into the arm itself or the lower leg. And to me, the really interesting thing about reflexology is that it's another layer of information. It's another lens to look through at how the body works. The body's really complicated, and it has sometimes reliable patterns that we can observe. And reflexology gives me some guidelines of how to approach the body. And neuromuscular therapy gives me a lot of guidelines how to approach the body. Myofascial ideas give me a new view of how the body moves holistically. As medical massage therapists here at Hands On Health in Cary, we are always thinking about the big picture. If you have pain in your hand or your wrist or your forearm, is there something else going on that can be contributing to stress in that area? Is there neurological impingement in the shoulder? Is there tight, imbalanced fascia in the torso? Is there thoracic outlet syndrome? Is there carpal tunnel? You know, there's all these different layers of approaches that we can take to try to sort out how to relax the tissues and how to get you the best possible movement, better flexibility, best possible use of your body for whatever kind of activity you're doing or sport that you're playing. And this kind of technique I would call definitely massage versus the step by step reflexology technique. I am sliding and gliding kind of my smooth knuckle over the thenar eminence. It's where essentially the biggest part of the strength of our hand is in that muscle, the opposable thumb. The opposing action is the strongest point. Our grip strength is where we have strength in our hands, and all the other musculature throughout the hand is about fine motor skill, precision. So I don't need to do deep pressure massage anywhere else on the hand. I really can't do deep tissue massage because it's not deep tissue, it's close to the surface. I'm right on the bones of the wrist with very little pressure from the outside in. And any massage or reflexology technique should be completely within the comfort level of the client. If the brain and the body feels like it's being attacked, it's going to start putting up walls and barriers and tightening up. And that's the opposite of what I want to achieve. I want the body to relax and loosen and become flexible and allow the most possible healthy blood flow and neurologic activity, lymphatic movement. So I'm going to wrap this up here. Again, I am nationally board certified reflexologist, Tom Maxson. I am also a licensed massage and bodywork therapist. I practice and teach here at Hands on Health in Cary, North Carolina. We have clients from all over the RDU, Raleigh, Durham, Research Triangle. We are easy to get to. We have a team of therapists who are excellent, highly trained in all kinds of medical massage, deep tissue massage techniques, sports massage. We work really well with other practitioners, with doctors, physical therapists, chiropractors, osteopaths, pre and post surgical for many conditions. If you're interested in an appointment, or if it's appropriate for you to get massage right now in your condition, give us a call. We'd love to talk to you and try to match you up with the best possible therapist for your needs. And if you have any questions about reflexology or anything else I've talked about during this video, please put some comments on the video or send us a message. We'd love to hear from you. Thank you so much for watching.